Here's the question. Why do high masking autistics have so many health issues? But first, some context. 11 different doctors in 1 year. The year before my autism diagnosis. 11. Most for multiple appointments and tests. Lung doctor, neurologist, psychiatrist, GI doctor, dermatologist, orthopedic doctor, a sleep specialist. The list went on and on and on. I was spending half my life in hospitals and clinic. So after my diagnosis, my wife Debbie and I had a theory that being autistic was somehow the commonality. But what about being autistic could possibly lead to these health issues? The answer was staring us in the face this entire time. But it took us a while to connect it. But before we talk about the key culprit here, let's look at some of the health issues we're talking about that are common co-occurring medical conditions for autistic people. And why the heck am I dressed up like a doctor right now? Also, I'm Chris, by the way, a late diagnosed autistic who also has ADHD. And I share my lived experiences, good, bad, and sometimes downright embarrassing on this channel, along with what my wife Debbie and I have learned as educators and through research. So subscribe for more, and let's dive in. Common health problems for autistic people. So what are some of the common health issues of autistic people that I was dealing with? Brace yourself, because this is going to get a little bit depressing and a whole heap load of ridiculous. Skin issues, itchiness, psoriasis, but also the general feeling of skin issues. Like my skin was feeling like it was on fire sometimes. Scalp issues, like itchy and burning, but also lots of weird skin pieces falling everywhere and making me look a little bit creepy and dirty. And the thing about it is, I'm not someone who had skin problems as a teenager, which is a question I've been asked. Lots of these cropped up in the years leading up to my autism diagnosis. GI issues. Constant stomach issues landed me in the GI doctor's office multiple times. The diagnosis ranged from GERD and acid reflux to early ulcers and lots of bloating. And we all know what comes after the bloating. I also coughed a lot. I mean, a lot. And had to clear my throat all the time, which was attributed to the GERD. I also had to go to the bathroom a lot. I mean, a lot. Because I had diarrhea a lot. I mean, a lot. Which led to other issues too, which I'll talk about more later. Lung issues. The constant coughing, which made me real popular during COVID, or not at all. It got me sent to the lung specialist, which has a special name that I seem to have forgotten. Pulmonologist. That's what it is. Anyway, lots of tests. Getting diagnosed first with allergies to dust, then asthma, then not asthma, bronchitis, then not bronchitis, but lung inflammation. Lots of tests, lots of medicines, yet still coughing. At one point, this doctor literally put his hands up and said, "I don't know. Don't see anything in the CT scans and nothing in the test results." Uh-huh. Glad we got there finally, doc. Only 27 appointments and hundreds of dollars later. But not to worry, I did figure out the coughing, and it's not lung related that I know of. Urinary issues. Okay, back to the bathroom problems. I was going through cycles of going to the bathroom a lot. I mean, a lot. I keep saying a lot, a lot. I mean, a lot. And I'm starting to annoy myself a lot. I mean, a lot. Idiot. I was going to the bathroom all the time, and the doctor thought I had issues with incomplete emptying. It's a little bit embarrassing. I was getting up all the time throughout the night to go to the bathroom, and just a little tiny trickle was coming out, which, I'm gonna be honest with you, isn't going to cut it. And it also led to the next issue, sleep issues. Oh yes, I have talked in a few videos about this, but since learning that even autistic kids struggle with sleep, and those sleep issues often continue into adulthood or get worse, this is related to autism. For me, falling asleep and staying asleep are both challenging. I struggle with both a lot. I mean, a lot. Why do I keep saying that? So because I was having trouble falling and staying asleep, getting enough restorative sleep was also a huge issue for me. So more often than not, I was having some nasty sleep issues. And don't get me started on insomnia, which I've struggled with off and on for a long time. Muscle pain, spasms, and tension. Then let's get into the physical issues. Constant muscle tension and pain. Neck, shoulders, my jaw. Had to get a night guard for teeth grinding after waking up a few times with so much pain, I could barely talk. So saw the dentist for that one and got that taken care of. So don't need to worry about me there. But so much tension and pain everywhere. My back. What the heck? And some days, especially after what I know now was a meltdown, I couldn't even walk the next day because my back was so bad. Walk? I couldn't even sit up or put on my own socks, people. It's not a good feeling, mentally or physically. It's also not a good look, ever. Headaches and migraines. Looking back, this one should have been a huge red flag. My headaches were constant, but especially linked to my sensory sensitivities. Smells, noises, lights equaled constant pain in my head. And not to mention the feeling of my brain being squished sometimes. Like a vice was on my skull, squeezing my brain that was too big and couldn't fit properly. Or sometimes it was like liquid ice with bouts of fire in my brain. Those aren't fun. They do not feel good. And what happens when you describe those sensations to a neurologist? That'll get you an MRI. Yes! Sensory nightmare, but also lots of looks of, okay, so it feels like your brain is on fire and also frozen. I totally understand that. And I've got the answer and solution you've been waiting for, said no neurologist ever. Immune system issues. I didn't really realize some of the issues, like the skin issues, could be related to problems with my immune system until the dermatologist sent me to see an allergist. Many tests later, and I had a compromised immune system. But how is that connected to autism and the underlying cause of all this? Stay tuned. Possibly POTS. I haven't been diagnosed with this, but I've actually never talked much to doctors about the way I feel dizzy pretty often, especially when I stand up too fast. But POTS is very common for many autistic people, so I'll mention that here. Mental health issues. Clinical psychologists and psychiatrists and therapists have gotten to know me well, but also not well at all, since they didn't pick up on my autism for a very long time. But I'm high masking, so we'll just say that they didn't get past my ninja-like camouflaging techniques. So I was diagnosed with ADHD, but while I was trying to figure out everything else going on, the mental health professionals I saw diagnosed me with a slew of other things, like OCD, generalized anxiety disorder, depression, agoraphobia, and bipolar, just to name a few. And they prescribed me with lots of medications, many of which cause me other health issues as side effects. Okay, what is the common culprit and one major reason why high-masking autistics have health issues? What's the common culprit in many of these medical conditions? Remember at the beginning of this video when I said it was staring me and my wife Debbie right in the face? Well, I wasn't exaggerating. This is where living in today's society being autistic is devastating. This is where everyone has this, or, dude, you're not really autistic, is so horrible for autistic people. If you don't know what it's like to be in fight or flight mode 24/7, you don't understand this. But if you're autistic, it's highly likely you are always feeling this. So what's the main culprit? Anxiety. So I know what you're probably thinking, but you don't have to be autistic to experience anxiety. So what the heck does this have to do with autism? This is true, but you have to understand, autistics experience anxiety on a whole nother level. That's a topic for another video. So in the meantime, you can find more information and resources in the description of this video down there to see why anxiety is so common for autistic people. And when I say common, there are estimates of up to 84% of autistic kids having anxiety. We also have a resource there for quick tips to reduce or relieve some anxiety. So check it out in the description. But back to today's topic. Anxiety isn't the only thing, but it's a major one. But here's where it gets really tricky. Here's the real kicker. These co-occurring conditions lead to more anxiety. So you go to the doctor so you can fix these medical issues, which leads to more anxiety. So you have new medical issues crop up or existing ones persist, which means more appointments, more doctors, more medicines, more stress and anxiety. So this is the conundrum. This is why it's so important that more medical professionals better understand the autistic experience. And what is that experience when it comes to doctors? Why is getting medical help challenging for autistics? Woo! So the solution, go see a doctor, is not so simple to an autistic person. No. No. And it often leads to more challenges than it's worth, at least for me. But leave the medical issues untreated and you're opening yourself up for a whole range of other challenges and possibly life-threatening conditions. Whew. Why is medical help challenging? Here are just a few reasons why. And if you're autistic, and the doctor sucks for you as much as for me, please add to the comments. Waiting for the appointment. Honestly, the stress of going to the doctor and just being there, which I'll talk about more in a minute, it starts for me at least the day before. Sometimes days or weeks before. Nobody likes waiting when you get there, but the waiting for me leads to horrible sleep the night before or possibly nights before. Then that day. If it's in the morning, I basically don't sleep the night before because I'm so worried about oversleeping. If it's in the afternoon, I spend the whole rest of the day trying to distract myself from the appointment, but I'm worried about missing it, so I keep checking the clock. And then waiting when I get there. That'll come in a minute. But basically, it's a whole day ordeal. Yeah, not worth it if I can help it. Getting there. The commute is a huge struggle for me. Drive myself? Not always an option, especially if I didn't sleep the night before. Take an Uber? High likelihood of getting car sick. For me, I could walk, but then I need to factor in weather conditions, how long it'll take to get there, if there's any obstruction on my normal path. Oh boy. Sensory issues of being in the clinic or hospital. Waiting rooms suck. So do doctors' offices. Doesn't matter if you add a TV or put in couches. Hospitals and clinics almost always are a sensory nightmare. The lights overhead hurt. The noises hurt. Screeching sounds of carts or people coughing. Phones ringing. Dings of elevators and beeping of machines. Public bathrooms for when you arrive and are sick from the commute. And don't get me started on the horrible smells of the hospitals. The stale smell of fecal matter mixed with chemicals and latex gloves and sick people. And all of this before you even get into the appointment. Communication challenges having to explain things to the doctor. Then you get into the room. The impatience of most doctors just seeps out of them. Already, I feel like I'm wasting the doctor's time. Wait, why am I here? Oh yeah. Tell him about the thing with my breathing. Wait, how do I tell him? Which spot is it exactly? So I tell him, and then questions. I wasn't ready for that question. Let me think. Point. Am I supposed to take this long to think? He's looking at me like he's bored. Just say something. Now he's saying I have asthma. Wait, we've been over this. It's not that. Remember when I did the inhaler for 3 years and they didn't help? Oh. Now he looks a little annoyed. Is he mad that I contradicted him? Oh wait, it's not that. It's actually being told it's all in your head, which makes you feel belittled and like a hypochondriac. Cue the mildly condescending tone that I've heard so many times in my life. So we ran the tests and they came back negative. Okay, so we know it's not that. What is it? Well, we don't know. Medically speaking, there's nothing wrong with you. I feel like that's saying I don't actually have a problem just because you can't figure it out. And aren't you supposed to try harder? Self-advocacy tips with doctors. One of the huge issues I've seen with medicine is that it seems really compartmentalized. What I mean is there's the specialist for this and another doctor for that. And that's great. I get that separately, they can all be experts in their own field. But when do they get together and work with one another to figure things out? Compartmentalized medicine doesn't work well for anyone, especially for autistic people. And maybe it's not the same in every country, but from the doctors I've seen, even when they are in the same hospital, the chances they are sitting down regularly and reviewing the notes on patients who have overlapping symptoms or issues is rare. So then it becomes my job as the patient to communicate across doctors. But communication is challenging for autistic people. And I'm not a doctor. So how can I communicate my needs well to the people who are supposed to keep me healthy? It's little wonder that a lot of people probably avoid going to the doctor, which is not limited to only autistic people. But it could also be why life expectancy rates for autistic people are way lower than for the general population. Would you want to be doubted and have this entire experience every time you go to the doctor? But it can improve if you learn how to self-advocate. A few quick tips. Write down all your symptoms and questions before you go to the doctor. That can lessen your stress of remembering. Disclose other health conditions, even if you can't see the connection yet. If you had appointments with other doctors in the past couple months, bring in a list of those and include why you went to see them. Bring a list of medications you take. Depending on the healthcare system where you are, not every doctor might have this information, and remembering on the spot can be hard. If you're diagnosed as autistic, this is one time when I personally think it's important to share that information and what you need based on that. If it's longer processing time when asked a question, say that before you even begin.
And just so you know, I might need a little bit of time to think before answering each question. So thanks for understanding.
If you are hypo or hypersensitive, this can also be important for them to know. Your pain threshold could be completely different from a non-autistic person, and a lot of doctors don't seem to get that yet. Bring a buddy. Having support and someone who could help you navigate the journey to the appointment or give you reminders of what you wanted to say can alleviate important brain energy. Then you can save your energy to focus on communicating your issues to the doctor. If it's a good friend, partner, or someone who knows you well, ask them ahead of time if they can help you think of and ask questions at the appointment. If they are prepared and don't feel like they are overstepping, this could be hugely helpful. Debbie does this regularly for me. Thank you, Debbie. I love you, Debbie. Don't rush the appointment. I know that you want to leave and go home, but you won't have this time again anytime soon, and your health is important. Don't feel rushed by the doctor. Make sure you get however much time you need. If the doctor seems to be on a timeline, make another appointment, but make it clear that you want to understand what's happening in your body. Okay, so the constant stress of anxiety, fight or flight mode activated 24/7, and navigating a world that isn't designed for us, which leads to more anxiety, are key reasons why many autistic people have ongoing health issues. Hopefully, the medical community will come to understand how challenging this also is for autistic people soon, which could help make it easier over time. And more on autism and anxiety later. Thanks for watching.